The United States has now surpassed 1,000 measles cases in 2025, marking a dangerous and deeply disturbing public health milestone. This makes it the second worst year for measles since the disease was declared eliminated in the U.S. in 2000, and with the year barely halfway through, experts warn that it may soon eclipse the record set in 2019. Far from a contained anomaly, this surge is unfolding into a multi-state crisis, centered around an explosive outbreak in West Texas that has already spread into New Mexico, Oklahoma, and possibly Kansas. The true number of infections is likely significantly higher due to widespread underreporting, yet even the current numbers are a jarring sign of how quickly a once-contained virus can reassert itself in a population where immunity is faltering. This spike isn't just a statistic. It's a direct indictment of the weakening societal trust in vaccines, a growing wave of medical misinformation, and a failure of public health leadership at multiple levels. Measles is not a benign childhood illness. It is one of the most contagious viruses known to science, capable of spreading through the air and lingering in a room for up to 2 hours after an infected person has left. Its complications, pneumonia, encephalitis, permanent brain damage, blindness, and death, are well documented, especially in children and the immunocompromised. In the United States, the MMR vaccine has been available for decades and is highly effective. 2 doses confer about 97% immunity. And yet, only about 4% of the 2025 cases were among people who had received even 1 dose. This alone reveals a staggering gap in basic immunization coverage. The outbreak unfolding in West Texas, which now accounts for more than 800 of the reported cases, is especially alarming due to its scale and speed. But what's even more unsettling is the nature of the communities being affected, many of them rural, underserved, and lacking adequate access to robust public health infrastructure. These are places where vaccine hesitancy has flourished, often stoked by online conspiracy theories, political extremism, and distrust in federal institutions. When outbreaks reach these communities, they do so with devastating efficiency, exposing systemic vulnerabilities that remain largely ignored by mainstream narratives. Making matters worse, the CDC itself appears to be pulling back on transparency. It has stopped providing detailed breakdowns of cases by state, and its national totals are often outdated, failing to capture the rapid pace of new infections. This lack of clarity is not just bureaucratic sluggishness, it sends the wrong message at the worst possible time. A clear and up-to-date accounting of measles cases is essential to mobilize public health responses, direct resources to affected areas, and inform the public. In its absence, misinformation fills the vacuum. Already, fringe voices are using the outbreak to question the efficacy of vaccines rather than confront the far more obvious reality. The overwhelming majority of those falling ill were unvaccinated. There is also an alarming rise in hospitalizations and fatalities. 13% of reported cases have required hospitalization, and 3 people, more than the combined total of measles deaths over the previous 20 years, have already died in 2025. Each of these deaths was preventable. That they happened at all in a country with the resources and infrastructure of the United States is a scandal, not a footnote. This resurgence of measles is not a blip. It is part of a broader unraveling of public health consensus that should concern every American. Vaccine refusal rates are growing, especially among younger parents who have never seen the consequences of vaccine-preventable diseases firsthand. Public figures who promote anti-vaccine rhetoric, whether directly or by sowing vague doubt, are emboldening this movement, often under the banner of medical freedom. This ideology, divorced from epidemiological reality, poses a serious threat to the most basic public health safeguards. The consequences extend beyond measles. A resurgence of one vaccine-preventable disease creates conditions for others to follow. Rubella, mumps, pertussis. Any of these could regain a foothold in underimmunized communities. And because measles weakens the immune system even after recovery, survivors, especially children, are more vulnerable to a range of other infections for months or even years afterward. The ripple effects of this outbreak may not be fully understood for a long time, but we already know enough to say that the damage will be profound. Public health agencies must now navigate a precarious situation, pushing for increased vaccination rates while avoiding further erosion of public trust. But the time for cautious messaging has passed. Clear, direct, and urgent communication is needed, backed by local outreach, mobile vaccination clinics, and where necessary, mandates. The federal government must also confront the online platforms and misinformation engines fueling this disaster. The cost of inaction is not hypothetical. It is playing out now in hospitals across the country. In sum, the measles outbreak of 2025 is not just a failure of health policy. It is a reflection of a society drifting away from the most fundamental norms of collective responsibility. It is a failure of memory, a failure of leadership, and a failure of courage. The last time the United States saw more than 1,000 measles cases, it sparked a nationwide conversation about vaccine coverage. That conversation must now resume. Only this time, it needs to be louder, more forceful, and anchored in the hard truth that complacency kills. If nothing changes, the worst measles year since 2000 will not be the last. It will be the new normal.